Hello, I'm Dr. Jean Lawrence of Lawrence Health and Wellness in Toccoa, Georgia. I am a certified nutritionist, master herbalist, certified functional medicine practitioner, doctor of naturopathy, and I have my PhD in natural medicine. I hope you enjoy the talk today. We're going to discuss the digestive system, and maybe this will answer some questions you've had about your own digestive system. Okay. First, we're going to talk about normal function and then dysfunction. Normal function. The food is eaten, it comes down the pipe into the stomach, where the parietal cells in your stomach secrete hydrochloric acid. We want the acidity of the stomach to be really, really good. A lot of acid. When it is nice and acidic, the pH of the stomach should be about 1.5. When it is this low, it will help protect you from bacteria and pathogens that can enter into the stomach, but it will also help you to absorb your minerals: calcium, magnesium, iron, B12, copper, and zinc. When this happens, your food is broken down, your minerals are absorbed, the food keeps going over here into the duodenum. This is the beginning of the small intestine. At this point, the pH should change from 1.5 to 4.5. When this happens, the gallbladder is signaled to release bile to mix with any fats that you have eaten so that you can absorb your fat-soluble vitamins A, D, E, and K. Then the food goes down into the small intestine, where a lot of nutrients are absorbed here. Then it moves into the large intestine. Bile works like Tide detergent in here so that you have nice, normal bowel movements. This is normal function. Now we're going to talk about dysfunction. This person eats some food, it comes down into the stomach, and for whatever reason, they do not make enough hydrochloric acid. Perhaps they have H. pylori, which is the most common infection in the world. It destroys parietal cells that make acid. Or as we age, we also produce less acid, but for whatever reason, this person doesn't have adequate stomach acid, so their food sits here and it starts to ferment. It's not being broken down properly. So it backs up the esophagus and they get heartburn. So they think, I must have too much acid, when in fact they don't have enough. So they take an antacid. When they take an antacid, it changes the pH. Instead of 1.5, now it's at 4. So they are not absorbing calcium, magnesium, iron, B12, copper, or zinc. If they don't absorb calcium and magnesium, they're having trouble with leg cramps, foot cramps, especially at night, dental problems, joint pain. If they don't absorb magnesium, maybe their blood pressure is elevated, won't come down, and they're not going to the bathroom very well. If they're not absorbing iron or B12 and they are anemic, which is not enough oxygen in the blood, then they're going to stay anemic no matter how much iron or B12 that they take. And if they're not absorbing copper or zinc, they're having easy bruising happening, they're having immune system problems, they're having skin issues, and they're losing their sense of taste and smell. So, here's the food. It's fermenting now because there's not enough acid to break it down, and this person will not absorb their minerals. But the food has to keep going. So when it moves over here into the duodenum that we talked about, was the beginning of the small intestine, the pH is about 4 now with the antacid, and as it goes to 4.5, it's not enough of a change to signal the gallbladder to work to release bile. So now very little, if any, bile is excreted, and now this person is not absorbing vitamin A, so they're having trouble seeing at night. They're not absorbing their vitamin D, and if they're not absorbing their vitamin D and their calcium and magnesium, they're not going to make bones very well, are they? And they're also not absorbing vitamin E and K. But the food continues to come down into the small intestine, but now they're either having constipation, which can lead to hemorrhoids and varicose veins, or they're having diarrhea whenever they eat something with fat in it. So if they eat a cream soup or a gravy or a hamburger or something, then there's not enough bile being excreted, the fat is going to run right through them and they're in the bathroom within 30 minutes. Or if this is also happening, not enough bile, then they're constipated, or they're having constipation and diarrhea alternating. Well, what if somebody's had their gallbladder out? What then? Well, then we use bile salts, which are a tablet form. to take with their meals because we have to replace what the gallbladder was doing. If it's not there, we have to support it as if it were still there. This is why some people take a lot of vitamin D and their levels do not change, because it's all about absorption. So we want to absorb all of our minerals, all of our fat-soluble vitamins. We want to go to the bathroom normally every day. We want to restore function because most of the problems in the body are coming from this area. If you fix this area of the body, everybody's happy, works very well. So this is our talk for today on the digestive system. If you have any questions, my email will also be included, but it is Lawrence, Lawrence, wellness @gmail.com if you have any questions about this talk. Thank you.